This video will show you how to use the OphthoSim Mobile on your smartphone. In this particular example, we're using a Samsung 10e phone. The first thing we're going to do is create a homepage icon in a standard way for an Android operating system. So we're going to add that to the home screen, and it'll be called OphthoSim Mobile. So we'll add it. And then we'll launch the program from the homepage icon in order to maximize the screen size. So we'll launch the program from the home screen icon, and you'll see now that there's no navigation bar, and we've maximized the use of the screen for the OphthoSim login. So we will now put in the username and password, which in this case we'll use student. It's a fake student account. And this is the opening screen that you'll see when you open your phone. So this particular scenario, the phone resolution has already been set up, but we will give you an example. I'll show you how to do that now, how to change it for your phone. So you have to create the video settings correctly for the program itself. So you select the settings button on the bottom left, and under the phone settings, in this case, we're going to select a Samsung 10e, and then press home. Okay, so now the phone is set up for the proper resolution of the phone. We suggest turning your intensity of your screen up to maximum, and also to remove the rotation button so it'll maintain a portrait view at all times, since that will maximize the use of the simulator. So the program has been designed to proceed in a logical way from introduction right to the exam section. Press the introduction section. The first section in the introduction is use of the control buttons. We'll go through these one at a time. So if I use the control buttons, you'll see that the navigation bar presented on the top allows for reading of the words associated with a particular image, and you use a scroll function in order to get to the bottom of the page. The next button at the bottom right will allow you to navigate forward and back on each page. The target touchpad, the second icon in the middle of your screen, allows you to select annotations, targets for you to identify in a verifiable learning format. And the crosshairs, as you can see appear, only appear when you engage the navigation button. We'll go through that in a little bit more detail in a second. The next button is the allowing of the viewing of the image that's displayed to the simulator attachment, because remember, the simulator is going to be attached to the top end of your phone. It'll allow you to view the image that you're looking at by depressing it. It allows you to see the image on the lower screen. And by using your pinch function on the lower screen, I can enlarge the image and move it around in order to see what is going on inside the simulator without actually removing the simulation hardware that comes with your purchase. And then the fourth button on the right is the eye movement button, which is an interesting way to practice your skills with some of the conditions that may inflict your patients with either random eye movement, blinking, nystagmus, different types of nystagmus, and you can engage all of them, which we'll describe here in a minute. You can convert your left eye to right eye with an icon to the left. So that flips the image from left eye to right eye. And then you have On the right, a bookmark in a heart, the shape of a heart. So if I want to bookmark this particular page and come back to see it, we can view it later. Or I can unbookmark it by pressing the button again. And the 1/8 is the progress in this particular section. So it tells me I've viewed 1 page out of 8 pages on this particular section. If I press the next button, you'll see now I'm on the second page, 2 out of 8, and it explains each of these buttons in the text. The target touchpad is 3 out of 8, 4 out of 8, 5 out of 8, etc. When I've completed a section, when I go back, you notice that using the control button bar has now turned blue, and it shows 8 out of 8, meaning that the section has been completed. In some of the long sections, the program will remember where you left off, so it'll take you automatically to the spot where you left off when you re-enter that section. Once you've viewed that section, if you want to use the history of ophthalmoscopy, if the buttons are lit up, that means that on the top, that means that they're available to use. So there's something behind each one of these. So for selection of annotation, for example, if I select an annotation, I have a practice button or a test button. So if I want to select an annotation, these are the annotations that are available, and I can scroll down if there are more of them. But these are the anatomical structures that I want you to identify potentially as a student as you're going through this content. So that optic nerve head, for example, it shows you where the optic nerve head is. So when you're looking through the ophthalmoscope into the simulator, you will see it outlined, and you can go to all the different anatomical landmarks if they're available with annotations and go through them to learn them. And then once you've learned them, I can press the practice button and I can test myself. So I turn the practice to test, select another annotation, let's say the optic nerve, for example. Now I have to use the target touchpad in order to move the target, the crosshairs to the target that I'm trying to identify, and then tap lightly on the screen, and you'll see that it correctly identifies the target. You'll also notice on the target touchpad there is a fraction, in this case 1 out of 1. That means that there was 1 annotation in this particular set, and you hit 1 of them. So you got all the annotations correct for that particular optic nerve head. There's only 1 optic nerve head, obviously. But if I choose another annotation, such as retinal vein branching, you will now see that there are 23 of them, because it says 0 out of 23. If I want to see where they are, I can see where they're at. Now you notice that some of them are off of the screen. So in order to identify all of them and see all of them, if I click on the target touchpad icon again for a second time, it goes from a blue color to a mauve or a purple color. And now using with that purple color icon present, I can use my capacitance touchpad targeting mechanism to actually, with my finger, move the optic image to any location of the retina that's within this particular image, and I can identify all the structures that are necessary to complete the exercise. So we'll go back. So you see now that I've completed the history of ophthalmoscopy, and I go through in this section the anatomy. Okay, so it gives me a little bit of explanation again. I can read that, and then I can again go through my structures that I want to practice and learn. And then examination principles and techniques. It discusses best methods for how to examine a patient using the direct ophthalmoscope. But if I don't have my device with me and I want to use the app mode, what we do is we can click that button. It squares off the image, giving me more real estate to look at. And with my device removed, I can actually go through the program with a larger phone in a very comfortable way. So in the next section, visual perception tests, there are 10 slides. This is where we test your acuity and being able to see through the ophthalmoscope. The next section is the target touchpad, which I've already explained a little bit to you. But the target touchpad is a very important mechanism or a feature of the program, because it allows you to target certain anatomical structures, landmarks, pathologies, and instantly verify whether you're correct or not. If we engage skill level number 1, you will see now that gives you a set of instructions. So now you want to practice by pressing the target touchpad button and selecting the annotation, hit the target. And in this exercise, you have to follow the yellow dotted line using your finger technique to bring the crosshairs into the target, tap, and then another line would develop to your next target, and your next one, your next one, and your next one, etc. And you can practice left and right eye as well. The order of examination is an important one to practice, because according to ophthalmologists, this is the order of the exam that is best recommended, so you do a thorough examination at all times. So if I engage the annotation function again and select hit the target, you will see that the first structure that you should look at in a controlled way is the optic nerve head, and then you should go in the superior temporal area to view that area next, and then to the superior nasal area, then to the inferior nasal area, then to the inferior temporal area, and then the last thing you would look at is the optic nerve fovea, or the optic fovea, which is the most sensitive part of the eye, and you don't want to spend too much time there, because it hurts the patient. The bright light hurts the patient in that particular location. So that allows you to practice the order of the examination, so you get into a routine of not missing anything. And also you could practice left and right eye by switching eyes, and make sure you practice both left and right eye. If I go to the feature identification, in this particular section, we help you identify, first of all, normal features on normal retinas, and then pathological features. So then you can put these two things together in order to diagnose pathological conditions. So in the normal feature identification, we have several different normal retinas. We want you to practice on all of them. So, because learning normal is the most important thing as a clinician, in order that you can refer or get proper care for the abnormal ones. So recognizing normal is very important. So in this particular section, you can read about each of the features, and then you can identify all the landmarks that are visible that you must be able to cope with on the direct examination of the eye. So the optic nerve is shown in this particular picture, the optic cup, the retinal branching from the veins, the venules, retinal arterioles, and finally the fovea. Once you've learned where those anatomical structures are and you want to test yourself, then I'll press the test button, select the annotation. Now I have to engage the target touchpad while I'm looking through the ophthalmoscope and identify the particular structure. Click on it. It turns with a white color circle around it, telling me that I've hit the target, and then returns to the target mechanism to the neutral position. If you want to get a better view, or a view of it without removing the attachment, I can press the image enlargement button, which now displays the image in the lower part of the screen, because remember, the top end is covered with your device. So now the image that I'm looking at appears in the lower image, and with a pinch technique I can make that image bigger and move it around as desired for viewing and learning. Now we learn the pathological features with the targeting mechanism. So these are the features that you must be able to identify as a diagnostician in order to monitor your patients for medical conditions as well as diagnostic purposes. So the first one is AV nicking. So this is an example of AV nicking, which signifies a person that may have chronic hypertension or atherosclerosis. And if I want to see where those structures are that we're trying to point out, I'll select the annotation, AV nicking, and you'll see the two spots that are shown on the retina that show this particular pathological condition. And once I've seen where they are, again, I can test myself with it by having to move the target mechanism up to the area and click on the 1. And then if you look down below on the screen, you'll see I've got 1 out of 2. In this case here, I'll click, and then I've got 2 out of 2. That's the pathological feature, and you go through all of these different features. For example, macular star gives you an example of a macular star, where it is, and then allows you to test yourself, to locate it yourself. Again, for verifiable instant learning. And if I want to bookmark this particular one, I'll just click on the bookmark, and we'll show you what that does later on. So back. So now it showed me that I've got 2 bookmarks present, one in pathological feature identification, the other in macular star. And as I'm working through this thing, if I want to view those bookmarks now, I would go to the home page, go to my bookmark section, and there they are there, the 2 bookmarks. There's 3 of them actually. And I can break the bookmark, I can view the bookmark and then break it by pressing the bookmark icon. That bookmark disappears. It goes to there's only 2 left now to view, read about it, break it. Or I can clear them all independently. If I went to the home page and the settings, I can clear all bookmarks. Tap to confirm, all bookmarks cleared. I go home, go to the bookmark page, there's no more bookmarks. So let's go back to the main menu again. So now the target touchpad, feature identification, I've done 3 things. The biggest section of the program is the pathology. You notice it's got 115 images, so it's very important that we have this function to take you back to where you are, because you could easily forget and not knowing where you're at in the program. So the memory of the program allows you to go back to see different areas. So let's take, for example, retinal vascular disease, diabetic retinopathy. I do proliferative diabetic retinopathy. I have 12 images to look at there with lots of annotations to target. I work my way through them. Say I get through 4 of them. I go back out, and you notice that it takes me right back to proliferative diabetic retinopathy. 4 out of 12 completed. If I click back on that section, it'll take me back to the slide I was at, and then I can complete the section by looking at all the images, doing all the annotations, and then when I go back out, it'll outline the fact that I've done all 12 and turn blue to show that I've signified that I finished it. So you work through all the different areas of pathology, and there's quite a few. And once you've done all that, then we'll go to the next section. Okay, the next section is for the use of the portal. So in the presentation section, you'll see that there's 0. So there are no presentations that were created by my instructor. If I click on that, there's no presentations available. So that means I'm part of this class. If I registered as part of the class, the professor did not create a presentation for the class or for me, so there's nothing for me there to view, so it's marked with a 0. But we will show you in a later video what happens when there is a presentation there for you to view. The search function is a search function that allows up to 50 hits. You see quizzes, there's another 0 there. Quizzes, there's 3 different types of quizzes. Those that are for you purposely directed towards you from your professor or from your instructor. If there were any like that, they're called defined quizzes. Then you would have a number of how many of those quizzes there were in that category. In this case, there are 0 quizzes that are defined for you, but there's plenty of quizzes to be taken for self-teaching. So in this particular menu item, you'll see that there's random diagnostic quizzes. So there's a standard quiz and a comprehensive quiz. So if we use, say, a standard quiz, this gives you the number of questions. You have 15 questions in this quiz. 0 have been answered. You have 6 minutes and 31 seconds left to do this test in, as you can see counting down on the right-hand side. You have to read the question, as you can see. The question, a 64-year-old woman with type 2 diabetes complains of blurry vision for several months. Her right fundus examination demonstrates all of the following except. So then I choose my answer. It's a multiple choice. So I have all of the following except. And remember, this is a quiz, so I can take as long as I want and make as many selections as I want. So if I put in an incorrect answer, for example, hard exudates, and I submit my answer, it turns red, meaning I've got an incorrect answer. If I look at other ones, that's the correct answer, disc neovascularization. So now I still have 5 minutes and 38 seconds left. I can go to my next question and read it and answer it as well. And they're all randomized with respect to their images as well, so you'll never get the same quiz twice. If you exit and re-enter, you'll get a different quiz. You may get the same question. It'll be in a different order, but you'll get a different image associated with that question. Comprehensive quizzes, a little bit more for higher end learners. Again, more geared towards the person with a higher skill level. You see, exams has a 0 beside it. That means that there are no exams for me to take as a student defined within my class. That completes a quick tour of the software, and we'll explain the remaining portal side of things in a separate video. I hope that you have lots of fun learning,